Well, you might be tempted to think that if you got multiple sclerosis, your dance card is full and you don't have any more room for cancer in your life. But do the studies support that? Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam and I've been living with MS for 40 years. I spend quite a bit of time looking at new information, the latest studies, the latest clinical trials, things that are going on in the MS world. And recently I saw an article that caught my eye that I'm going to share with you. And it looks at studies that try to determine whether or not having MS makes us more or less susceptible to cancer. And I had a specific interest in looking at this one. Perhaps many of you do as well. Why don't we go ahead and we'll look at the article together, and then I'll share a little bit about what's been going on with me. I saw this article in MedPage Today. I did not see a date on it, but I think it's pretty new, as of February the 5th, 2025. And it's called For Your Patients, Is There a Connection Between MS and Cancer? Research may be inconclusive, but you can still minimize your risk. And here's what they have to say. According to the National Cancer Institute, approximately 40.5% of Americans will be diagnosed with cancer at some point during their lifetime. Wow, that's actually a very large percentage. If you have multiple sclerosis, the autoimmune disease in which the immune system attacks the brain and spinal cord, you might wonder if you're more likely to develop cancer. The short answer is that no one knows. Well, are we shocked? No. Because no one seems to know anything definitive, do they, when it comes to MS? But the topic has attracted a lot of interest among scientists. They have analyzed data from many large databases using a variety of statistical methods and focusing on different cancer types. These studies can only show associations, though, not cause and effect, which means any increased or decreased risk of cancer could come from many other factors besides MS. Okay, those are all good disclaimers. We have now made them. Let's go on and see what we actually found. Here's a look at what some recent large studies have found. Okay, study number 1, increase in bladder, brain, and cervical cancers. A 2024 study from France found a 6% increase in the risk of people with MS developing any type of cancer. The risk was highest for bladder, brain, and cervical cancers. People with MS had a lower risk of prostate cancer, colorectal cancer, and breast cancer than people without MS. The researchers used 10 years of records from France's national healthcare system to compare the records of people who had MS with those who didn't, to see how many were screened for and diagnosed with cancer during that time. The study included approximately 140,000 people with MS and 560,000 without, so quite a large sampling size, I would say. Both groups were matched to be of similar age and sex and by whether they lived in a rural or urban area. The records were not screened for smoking status or other lifestyle issues. Yeah, so we don't know if the person ate junk food all day or if they were vegan or what they were. So, and as we know, that can make a big difference. But they did do some screening at least. They tried their best to do some matching. The study showed that cancer risk compared with people without MS was higher in people with MS, younger than age 55, and lower in the group with MS who were age 65 and older. Additionally, fewer people with MS were screened for breast, cervical, or colorectal cancers than those in the control group. I am not sure what that means and why it's important. I don't know. It might affect the data. This was especially true among study participants aged 65 and over. And as for their statement that talking about the risk being higher in people younger than 55 than older than 65. I think what they're saying is compared to the population without MS, that would be true. And the reason for that, I think, is pretty obvious. The people that are over 65 are at increased risk for cancer. I think as we get older, the risk of cancer of all types increases, right? So it makes some sense. And then study number 2, no overall increase in cancer. So in 2021, researchers in the United Kingdom published a study that found that people with MS were not more likely to develop cancer than those without MS. Over time, however, people with MS received a greater number of cancer diagnoses than individuals without MS. Okay. The study information came from a national database and were collected between 1987 and 2016. Included were approximately 10,000 people with MS and 40,000 matched controls. Patients were matched by sex, age, geographic range, and the year they joined the database. Now, study number 3, increase in bladder cancer. Another cohort study comparing cancer risk in people with and without MS included provincial data from Manitoba and Ontario, Canada. The 2021 study involved 53,000 people with MS and 270,000 without. These are huge numbers, by the way. The research team also used cancer registries to estimate the number of new cases of breast, colorectal, and bladder cancers, among other cancer types. The analysis showed that bladder cancer rates were higher among the MS group. There was no difference in the rate of new cases of breast cancer risk or colorectal cancer between the cohorts. As was the case for similar studies, the researchers had no way to account for differences in lifestyle factors. The team also noted that urinary issues are common in MS and that the treatments themselves may make people more likely to develop bladder cancer. And I think that's a very important point. We get so many scans, we take a lot of different medications. All of that might increase our risk for cancer. So it may not be the MS itself that's causing the cancer, but things that we do to either diagnose or treat it. Interesting point, and I'm glad they made it. And then we have study number 4, increase in brain, urinary tract, and lung cancers. A study that compared cohorts of people with and without MS in a population health registry in Norway, then compared the MS group with records in the Norwegian Cancer Registry. The study included 7,000 people with MS and 38,000 people from the general population. And of course, you realize that in the general population, you've got all kinds of lifestyles and propensities and everything else. So hopefully the large sample size will more or less blunt the effect of those factors because it's hard to control for them. And anyway, they say that the study, which was also published in 2021, compared cohorts from 1953 to 1995. That's a nice long range. The era before disease-modifying treatment, DMT, became available. That's very good because that does negate some of the risks that we talked about before, that perhaps the treatment of MS in itself can cause cancer. The team then looked at data from the DMT era of 1996 to 2017, acknowledging the effects that the widespread use of DMTs could have had on cancer risk. The authors found that more new cases of cancer occurred in the DMT era. Specifically, there were more cases of brain cancer, cancers of the urinary tract, like bladder cancer, and cancers of the respiratory organs, including lung cancer. This increase was most common among people with MS age 60 and over. In the pre-DMT era, people with MS did not have a higher cancer rate, the researchers found. Although dividing the data by whether or not DMTs were available let the investigators account for an important difference between the groups, other explanations could explain more recent higher cancer rates, the team said. Another thing I'm thinking is that in the pre-DMT era, people weren't diagnosed with MS like they are now. I can speak from experience on that. They did not want to say that I had MS because they had nothing to give me. There was no treatment. There was nothing to do for it. So I think that you've changed then the number of people that you're looking at who have MS by probably quite a bit. Anyway, here's study number 5. Reduced cancer risk for people with MS. Now, here's a different thing entirely. It says that having MS reduces your risk of cancer. Iranian researchers in 2020 conducted a meta-analysis, which, as we know, means that all they did was look at the data from studies that were already published. Of the pooled data from all the studies published to that point that assessed cancer risk for people with MS, the team found that people with MS had a lower risk of developing cancer compared with the general population. And that might even be true because, as we were seeing in some of the studies, there's a question about whether the treatments and diagnostic tools that we use for MS might cause cancer. And they go on to talk about what we know about MS and cancer risk. The wide range of results in these studies means that there are well-regarded studies that show that cancer risk for people with MS compared with the general population are either the same, lower, or higher, at least when it comes to specific cancers. These varied findings may be linked to different populations and research methods. It is also possible that DMTs have a role in regulating the immune system in ways that could possibly contribute to the development of cancer. Lifestyle factors undoubtedly also play a role. To date, researchers using large national data sets have not been able to show how key lifestyle factors, especially smoking, affected the results. Smoking rates in most countries have declined significantly over time. So there you go. The data from those studies that started back in the 50s, a lot more people smoked, at least in the United States. I remember growing up, lots of people seemed to smoke. That's a very good point. We don't know what effect, although we can guess that it probably increased at least the lung cancers and possibly other ones. Additionally, many cancers are more common among people with low levels of physical activity and/or obesity, both of which can affect people with MS who may have mobility impairments. Poor nutrition and excess alcohol consumption, both of which may be linked to depression, which is more common in people with MS, may also contribute to certain cancers. Since MS is a chronic disease that relies on periodic brain magnetic resonance imaging, or MRI, for monitoring, this extra scrutiny could explain why some studies show that people with MS are more likely to be diagnosed with brain cancer. That's right, so the diagnostic tools would point out something that perhaps without the MRI you would never know, or you wouldn't know for years later. It could be, therefore, that brain cancer is not actually more common in MS patients, but simply that it's more likely to be found in the course of monitoring MS. And I'm very glad that they're looking at these things because it's common sense, and it does kind of help you put the data in better perspective. The opposite could be true as well. Increasing age is a risk factor for almost all cancers, but what if something happened that made people receive less screening over time? MS is a progressive disease, and many people's disability burden increases over time. Perhaps the increased effort needed to manage worsening MS symptoms interferes with regular cancer screening schedules. So that kind of loops back around to that question we had earlier. Why the amount of screening for MS patients seem to be less than the general population. I guess it's a possibility that it could be that we just don't go because it's just too much trouble to go. But I don't know if I've found that true for myself. I can't speak for everybody, but that's interesting. I'd be interested to know, have you stopped some of your regular screening because it's just too big of a pain to get out there and do it? Or for other reasons related to your MS? Anyway, they talk about understand your cancer risk. Here are some suggestions for managing your health and addressing any concerns you might have about potentially increased cancer risk due to your MS status. And they say that you should discuss your cancer risk with your neurologist. They will keep you up to date with the latest research and can help sort out what the newest findings on cancer and MS might mean for you. I think that depends on your neurologist. Some of them seem to keep up with things outside their field, and some of them don't. And then they say, don't skip your annual physical. Of course, you see your neurologist multiple times a year for MS-related challenges, but you still also need your primary care provider to manage your overall health, such as age-appropriate cancer screening, and to address common issues like blood pressure and cholesterol levels. And I'll speak to that for just a second, because when I was on long-term disability, I was required to fill out a form every year to make sure that they knew that I was still, in fact, disabled. It also kept me pretty honest about seeing not only my neurologist, but my GP as well, and getting a mammogram and doing all the things. But I'm hopeful that I will still continue with those, even though now that I am done with all that and I'm on full retirement with drawing a pension, which is not dependent on filling out any forms, will I continue with all that? And I would hope that I will, but only time will tell. And then their third point is keep current with cancer screenings. As you age, more screenings become necessary to keep you healthy. Women need mammograms and pap smears, men need prostate cancer screenings, and everyone needs regular skin checks. There's a lot to keep track of. Fortunately, the American Cancer Society offers a convenient summary of cancer screening guidelines by age. And to speak to that for a minute, I was recently told by my GP that I've aged out of pap smears. The only reason that you would continue to do them is if you'd had some kind of adverse result on a recent one. But since I haven't, she told me that at my age I don't have to do them anymore. So there you go. I figure that given that I have enough other stuff going on that gets me scanned, I'm not going to worry too much about not getting a pap smear. I'm just going to say, yay, one more thing I don't have to do. Well, I thought this article made some really good points. I appreciated that they clarified a few things and that they recognized some of the variables that might skew the data. There's probably others they didn't think of, but perhaps it's good enough, it's close enough because of the large sample sizes. We probably can take some of what they say to the bank. I don't know. It's very individual because another thing that they didn't really look at was everyone's family history of cancer, because quite often cancer or the tendency for cancer is inherited from your parents, your grandparents, and so on. But I just wanted to let you know what's been going on with me lately, because it's kind of totally blown up the idea that just because a person has MS, they're not going to get cancer. Because I used to joke and say that that would be the case until 10 years ago when I was diagnosed with liposarcoma, which is a very rare cancer to get. The articles that I've read say that only 3 people in a million get that kind of cancer, and of those 3 people, 2 of them tend to be men. So I've been joking that I'm 1 in a million. I had surgery to remove a very large tumor 10 years ago, and I've had scans every year ever since, and they've always been clear until the last one within the last year showed something kind of suspicious. And you know what? It's come back. And it's come back with a vengeance. So it looks like I'm going to be going through surgery again here within the next couple of months. I have to go through radiation first, 5.5 weeks of that. I might participate in a clinical trial, which I understand could be done simultaneously with the radiation treatment. But at any rate, I'm figuring I'm probably going to be doing surgery April, May, somewhere in that time frame. And I'm going to try to get ahead on videos so that things will run smoothly while I'm gone. But if you ever pull up my site on a Tuesday and you don't see a new video, now you know why. It's going to be a rather complicated surgery, I'm afraid, and so I don't even know what the prognosis is as far as recovery, follow-up treatment, anything. I don't know at all at this point, so I really can't tell you much. But I do want you to know one thing. I've been very happy these last few years to be doing this site and getting to know some of you, and I hope that we will continue to have these lovely conversations that we've been having. I do appreciate you all very much. And I expect to be back right here, and I certainly will keep you posted as to how it's going. Maybe I'll even get daring and do one from the hospital. I'm a fine spokesman for the idea that you need to take really good care of yourself, because my doctors keep telling me what an ideal patient I am for cancer surgery because I'm so healthy. So there you go. There's a testimony for you. So go ahead, take really good care of yourself, and I will see you again in my next video, unless something pretty catastrophic prevents me from doing it.